Hi everybody, Yvette Kuyate of Kuyate Law Group. Today we're going to focus on advanced healthcare directives, what they are, why they're important right now at a time with COVID, and why everybody should have one. So advanced healthcare directives, if you don't know, are essentially instructions for healthcare workers when you are incapacitated, unable to speak for yourself, and it gives somebody, your agent, the power to go ahead and communicate your wishes with advanced healthcare directives if you're ever in a situation where you are unable to speak for yourself, unable to communicate with them about your health and decisions like that. Many times people think that they are only for end of life, not necessarily. Everybody that's ever had a surgery done, gone under, knows that one of the things that they do, they ask you if you have an advanced healthcare directive and who the person would be as your agent while you are under. If there needs to be a call made on a specific medical issue, that agent is the one that speaks for you essentially while you are sedated. So it's not necessarily only for end of life decisions. Right now, at a time with COVID, of course, it is very important that we are all mindful and we are aware that right now, with everything as it is, you don't want to not have one so that healthcare workers are left to guess. Family members are right now being impacted in that I'm hearing stories that they can't be visiting family, they can't be there. There's been several instances where people have passed away without being able to have their family and friends nearby. This is our reality in an era of COVID. And so advanced healthcare directives essentially give an agent of your choosing the power, like I said, to take over and communicate your wishes. Things that are included in an advanced healthcare directive are things like the decision to prolong life or not, and special instructions as to who would be able to determine incapacitation, designation of a primary care physician, whether you want that person to be the one or the attending on call that day that makes the call, and organ donation, for example, all organs or some organs. Those are all decisions. So when I speak to my clients about advanced healthcare directives, and yes, by the way, I do include them in every packet that I make, whether it's a will packet or a trust packet. Those are very important documents that are included in there. So when I speak to my clients about advanced healthcare directives, I give them a sheet of paper to kind of get them thinking about what it is that they would want on theirs. I will note that for parents with adult children and children with parents, it's a good idea to have those conversations now and just have those kinds of things in order and place. And right now, I'm happy to draft advanced healthcare directives for anybody that needs one, for a loved one, or yourselves. So communicate with me if that is something that you would like to do. I hope this answers your questions on advanced healthcare directives, why they are important, especially right now at a time where we are in unprecedented COVID times, and what the power that they have essentially to communicate your wishes to healthcare workers. So I hope this is useful. Please feel free to share it, and there will be more videos upcoming. Thank you.